When traditional measures for severe depression, such as counseling and medications, do not improve symptoms, a patient may be a good candidate for one of Baptist Health's innovative depression treatments, and today I will discuss electroconvulsive therapy, called ECT for short, and how it works to improve depression. Modern ECT, which is done with the use of anesthesia, is a highly effective, evidence-based, FDA-approved treatment option for patients with treatment-resistant conditions, and also it is available and a great option for patients with severe and urgent psychiatric conditions. What is essentially happening in ECT is we are applying a very brief and controlled electric pulse that is causing or bringing about seizure-like activity. This seizure activity brings about changes in the neurochemicals. It's almost like pushing a reset button, so to speak. We start noticing big improvements in their mood and their overall activity levels. A good candidate for ECT would be someone with severe depression, patients who have stopped eating and drinking, patients who are highly suicidal, patients who are catatonic, also patients with bipolar disorder who are extremely manic and are treatment resistant, or who are extremely depressed are great candidates as well. Patients in the geriatric population are also good candidates for ECT, and patients with severe psychosis and who are pregnant, ECT can be a very safe option to consider. With ECT, the effectiveness, the response to treatment is something to the tune of 70 to 80%. It is a very safe and very effective treatment option available to patients.
I had a number of years where I had a variety of illnesses and ultimately ended up in a state of severe depression. I had 8 visits to the ER. Each time being told they could find nothing physically wrong. My 2 favorite activities for exercise were walking and swimming. And over time, my walking came almost non-existent, as did my swimming. I just had no motivation, and I also lost a significant amount of weight. The team at Baptist, Dr. Pataya and her team of nurses and technicians, the anesthesiologist, all made it just seem easy. It was like coming and seeing my family for each of the treatments. Well, I was just so grateful because I was starting to feel like myself very quickly. You could see improvements, and by the time we had had 8 treatments, I was better than I think I ever was. This was truly a miracle.
I told Dr. Pataya and a whole bunch of other people, when they gave me my wife back, they gave me my life back.
And it's only going to be better from here.